everyone. Thank you for joining me and Neutrogena for an important conversation about melanoma and sun protection, brought to you not only by Neutrogena, but also Walgreens and the Melanoma Research Foundation. My name is Dr. Leslie Rank. I work at Neutrogena as a scientist in our recreational sun R&D program. So my job is actually to develop the process and innovation behind our new sunscreens that support the brand. And today we're going to be going live with Dr. Zion to learn more about sun protection and melanoma. So with that, I'm going to invite Dr. Zion to join this live. Let's wait for her to join. One second, guys. Dr. Zion hopefully will be joining us shortly. There she is. Thanks for holding on to that with us, guys. Zion is with us now. Hi, Dr. Zion. Thank you so much for joining us.
Hi. Thank you so much for having me. I am Dr. Zion. I am a board certified internal medicine physician, and I'm currently practicing in South Carolina here in the US. And having born in Seoul, Korea, and seen firsthand, I have a special passion for holistic wellness and dermatological skin health. So want to first thank Neutrogena for helping making this live possible and their continued efforts to bring awareness to melanoma and prevention of skin cancer, which I have a lot to say about. So I'm honored and thrilled to be here with you today. Thank you so much for having me.
Thank you, Dr. Zion. We're so excited to have you. Really, truly, we love seeing everything that you post from your skin routines and advice. So we're happy to see what you have to say today about melanoma. So this TikTok is, of course, brought to you by Neutrogena, Walgreens, and the Melanoma Research Foundation. The Melanoma Research Foundation is the largest independent organization devoted to the study of melanoma. They support medical research that supports the study of new treatments and a potential effective cure for melanoma. We encourage you to follow both Walgreens and the MRF, or Melanoma Research Foundation, on their social handles, or visit melanoma.org and follow their Get Naked campaign to learn more about sun protection and melanoma. So with that, I'd love to dive into this, Dr. Zion. It's great to meet you and to have you here, as I said. And so today, I'd like to kind of ground this conversation in a few statistics that are pretty striking about misconceptions surrounding sun protection and sun damage that you can have to your skin. And the first one is that more than 50% of consumers don't think that they're exposed to sun enough to warrant the use of sunscreen. And after that, an additional factor is that 22% believe that their skin type doesn't burn easily. So, for the point of this conversation today is really to dive into these misconceptions and, bring to light and debunk some of these myths while also learning more about, the risks of skin cancers and about melanoma. So the first question I'd like to ask is, what do you say to people who think that sunscreen is just for people who are going to the beach?
Yeah. So, when it comes to sunscreen, you have to remember it's all about prevention. And we're going to talk a lot about this today. Preventing premature aging, dark spots, and obviously skin cancers like melanoma. And that means proper sunscreen application every single day, regardless of circumstance. So I'm talking not only about sunny days, but gloomy, rainy, snowing, indoors, outdoors, driving, no matter the circumstance or the environment, we're constantly being exposed to the sun's harmful rays. So sunscreen is meant for everyday health, not just on beach days.
Couldn't agree more. Definitely need to be wearing sunscreen even when it's cloudy outside or you're indoors and are standing next to a window. So even when we're all working from home.
Exactly.
The next question, or topic I'd like to think about or delve deeper into, is about sunscreen usage across people with different skin tones. Black people or people with darker skin tones are 2 times as likely not to wear sunscreen versus Caucasian people. And what could be potentially fueling this?
Yeah, so that's a great question, and I actually have a lot to say about it. I think there are a few things, just a couple things fueling this trend over and over again. There's a lack of equitable access to resources, notably images of Black skin health concerns. And I myself have seen this going through medical school and residency. And the fact that those with darker skin typically mean less likelihood for sunburn. So first and foremost, it's important to remember that UV rays damage our skin no matter our ethnicity or skin color. And I tell my patients to think of the sun as you would cigarettes, right? It does not discriminate. Your risk of cancer goes up regardless. And it is true, actually, that increased amount of melanin production gives you some inherent protection. Darker skin can mean less likelihood for a sunburn, but this is not enough to completely bypass sunscreen use. So we also can't forget other ways that sun can harm our skin, right? There's peeling, there's worsening dark spots, exacerbation of rashes from systemic diseases I see quite often in my office, like lupus, eczema, rosacea, just to name a few. And most importantly, the risk of skin cancer. And what's really interesting is that African Americans report peeling as their top sign of sunburn compared to Caucasians who report, their skin feeling hot. And so studies have shown that the most severe and the painful sunburns actually come from those with darker skin phototypes. Um, Another thing I wanted to mention on here is that not many people know this, but Bob Marley actually died of melanoma in his mid 30s. Like when it comes to melanoma, no one is invincible. He had a dark spot under his toenail, thought it was from a soccer injury, but unfortunately, not been empowered with the knowledge to know what to look out for, what skin cancer may look like on his skin, and that he needed to have it checked out. So we know that most melanomas are caused by UV rays, but it's important to be aware of these lentiginous melanoma. And these develop on hairless skin. So like skin under the nail or soles of the feet or palms of the hands. And although those are more rare, it's actually the most common form of melanoma found in people of color. Um, so I wanted to also mention on here that MRF recently launched a resource hub on their website for skin of color, which goes into these misconceptions and facts that we're talking about surrounding melanoma in Black and brown skin. And I want to highlight that it includes imagery of what melanoma looks like in skin of people and like how to identify it, which I think it's so valuable because I feel like I myself didn't even get this sometimes during my medical training. So this is a fabulous resource that I think everyone should check out, including healthcare providers.
No, that's wonderful. I myself will be checking that out probably right after this call.
Yeah.
Runs in my family, and my paternal grandmother did pass away from melanoma when she was 32 years old.
Oh
And
my
I,
goodness.
a lot of moles and just a lot of spots, so it definitely is top of mind for just kind of understanding what are the signs of skin cancer. And so being able to see that on a variety of different skin tones is really important. So thank you for sharing that. And while we're
Yeah.
on this, really important discussion, I'm kind of shifting gears, but staying on topic, talking about this concept of base tanning. So a lot of people, especially here, we're still really like the tan aesthetic. People still
Mhm.
do sometimes use tanning beds with this understanding that you need to have a base tan to prevent you from getting, further sunburns or, that it will help enhance your exposure to the sun. So can you tell us a little bit more about that myth right now?
Yeah. I think before I go into that being a myth, which it is for sure, I will confess on here that I had my own rebellious days and I didn't know any better. I definitely used tanning beds quite often and I cringe about it now that I know what I know. Um, I do think that indoor tanning is not as prevalent as it used to be back in my days, or I sure hope not. And for those of you who are still partaking in this, listen up. So, the idea of base tan prior to beach trips or going out in the sun, that's been around for a while. But research has shown that not only does indoor tanning not prevent sunburn, but increases your risk of developing cutaneous melanoma by 75% when using tanning devices before the age of 30. And that's a crazy stat, 75%. And so it's actually been classified into the highest cancer risk category by World Health Organization, International Agency for Cancer Research. So bottom line here would be don't do it. It's not worth it.
Well, thanks, Dr. Zion. I know that when we think about sunscreens, we often think about the protection against burning, but that's actually from a completely different form of UV radiation. There's two types that we mostly think about when it comes to sunscreens, and that's UVA and UVB. And a quick way to think about that is UVA is for aging. UVA causes the aging. It also causes the tanning, and that's a longer wavelength than the UVB, which is a shorter wavelength form of UV radiation that causes the burn. So, they aren't really linked, and so it doesn't help you from preventing getting those sunburns in the future. But surprising stats really about, the World Health Organization.
Yeah, no, I love that too. UVA for aging and UVB for burning.
So now that we know a little bit more about the risks, let's discuss a little bit more about prevention and identification of melanoma. So one of the biggest educational principles of the MRF is, of course, prevention. So what are some of your recommendations for preventing melanoma and other skin cancers?
Yeah. So I sound like a broken record at this point, but prevention is the number one consideration. And that means proper sunscreen application every day, like we talked about. And there's other ways you can also protect yourself on top of sunscreen, right? Wearing hats, sunglasses, UV protectant clothing. You'll actually see Koreans even wearing umbrellas in the middle of a sunny day for that reason. And even reapplication of sunscreen when that's appropriate. And so there's genetic predisposition when it comes to melanoma and skin cancers that we have no control over. Like you talked about, Dr. Rank, if you have excessive number of moles, that already puts you at risk compared to base population, or being immunocompromised, or even having family history of melanoma. I actually personally have a genetic condition called Lynch syndrome, which puts me at risk for melanoma in particular. And so, having said that, those are the things we don't have control over. But according to MRF, nearly 90% of cutaneous melanomas are related to excess UV exposure. And we have complete control over that, right? And that's a major risk factor that we all can prevent over the course of our lifetime.
Well, now that we know how important prevention is, and we have to keep reminding ourselves, of course, there's just so many sunscreens to choose from. So do you have any favorites that you can share with us?
Yeah, so I'm actually a big fan of Neutrogena sun care. So thank you for your innovations, Dr. Rank. They offer, I feel like, a variety of options that you can customize to your specific skin needs and your lifestyle, which I love. If I had to pick my personal favorite, it's probably the Ultra Sheer Mineral Stick. It's vegan friendly, it's non-greasy, has SPF 50, it's portable, swipeable. I carry it around everywhere. There's no white cast. The best thing is like you never have to get your hands messy. That one's probably my favorite.
Oh, well, that's wonderful. Thank you, Dr. Zion. I know it's great to have many different formats of sunscreen so that we can use it
Exactly.
in all the different situations that arise in our daily life. And one question that I've seen kind of come up here on the chat has been, people asking, what's the best sunscreen to use if I have acne-prone skin? A lot of times we think about the more chemical-based sunscreens as being a little bit more oily, but one great one that I recommend from Neutrogena is our Clear Face platform. So look for the Neutrogena Clear Face products, and these are going to offer you, high SPF protection, non-comedogenic formulas that are made for people with acne-prone skin in mind. Another one of my personal favorites is the Neutrogena Invisible Daily Defense
Oh,
Serum.
I love that one.
Oh, it's really hydrating, it's
Yeah.
fragrance free, has a great aesthetic, it's really light and non-greasy. That's one of my go-to favorites for my everyday application. So now that we've talked a little bit about some of our favorite sunscreens, I personally would like to tell everybody here a little bit more about the differences between chemical and physical sunscreens or mineral. So I mentioned a few of my favorite chemical sunscreens. Dr. Zion mentioned a mineral sunscreen that she happens to love. So what's the actual difference between chemical versus physical sunscreens or mineral? And so really it's in their mechanism of action. Chemical or organic sunscreens work by actually absorbing UV radiation. So those mineral filters absorb the UV radiation and then dissipate that energy in the form of heat. In contrast, mineral or physical sunscreens have active ingredients like titanium dioxide and zinc oxide. These work slightly differently. They do have some capability of absorbing that energy, but mostly work by deflecting or reflecting that radiation off the skin. And so they have often very different aesthetics, but if you have two different sunscreens that are different categories, one's chemical or maybe one's physical or mineral, they both have an SPF 50 and they're both giving you the same level of protection against sunburn. They've both been tested by the FDA methods and have the same label claim. So really, I recommend, again, in line of thought with prevention is key, using the sunscreen that best fits, your daily lifestyle so that you just keep wearing and keep reapplying. So now, now that I've given that spiel, we'll go back to other aspects of prevention. So everyone seems to know that they should get their skin checked, but they don't necessarily go to the doctor or monitor their own skin. So can you go into more details, Dr. Zion, about how people should be using these skin checkups in their daily, life?
Yeah. So I recommend a skin check with a healthcare professional, whether that be your primary care provider or dermatologist, at least in an annual basis. So that's once a year. But I also encourage all my patients to do self-examination. So many are going to be surprised by this, but many, and not a majority of the skin cancer is actually found by the patient and not the doctor. So tell my patients to strip naked and do a full body check every month if you can. And if you're already naked, so before, after showering, or in the middle of changing your clothes, whatever works for you, just do it once a month. And a pro tip I tell my patients is to take pictures. So this is a great way to keep track of your spots that seem suspicious to you. Um, there is a super helpful step-by-step guide on Neutrogena.com that is worth checking out. And I want to say, I said a bit earlier that melanoma is not as common for people of color, but when it is diagnosed, it is found at a later stage and it makes the treatment very difficult. And unfortunately, studies keep showing that people of color are more likely to die from skin cancer compared to whites. So if you're hearing this and saying, "Well, I have darker skin, don't need to check my skin regularly," not the case. And speaking of stripping naked, MRF is running the preventative campaign Dr. Ring talked about, hashtag Gain Naked, talking about like full body checks, raising melanoma awareness. I think they even developed an Alexa-enabled app to help you with these. So, guys, there's no excuses.
Well, I love the idea of taking pictures. That really helps you kind of track and monitor, what's
Yeah.
kind of going on in your skin. So the next question I have is, what are some of the initial potential signs of skin cancer that viewers should be looking out for when they are doing these skin checks?
Yeah, so there's a great acronym that's easy to remember if you're an English speaker. It's the ABCDEs of melanoma. And I first heard of this when I went to medical school. A is for asymmetry, if one side of the mole looks different from the other. B is for border. So if the border of the mole looks ragged or blurry, it should be clean cut. C is for color. So if there's different colors within the same mole, that can mean something suspicious. And D is for diameter. If size of the mole is bigger than a pencil eraser or about greater than 6 millimeters, something to worry about. And E is evolving. And I personally think that this is the most important with anything in medicine. So in this case, since we're talking about moles, if it's changing in size, shape, color, height, or if there's any new symptoms. So if your mole starts bleeding or itching or crusting, it's definitely time to go see someone and get it checked out.
Okay, well, yes, absolutely. Great advice, Dr. Zion. The ABCDEs of melanoma. Great acronym.
Yes.
So now that we've talked about this, let's move on to one of our last subjects for the live, which continues going into this melanoma education and the importance of raising awareness around sun protection. And I know we've touched on this already, but there are several types of skin cancer and there are several kinds of melanoma. So even with people understanding the dangers of UV radiation, the education around sun protection is still a necessity, and that's why I'm so happy we're talking about it here today. And wearing sun protection on a daily is also very important that we all need to be doing. But do you have any other tips for people who do that?
Yeah. So if you've ever seen me on social channels, you may have met my Korean mom. She's on there quite often. And so, I was born into a family that values healthy skin. So my culture, Korean culture, prioritizes holistic health that looks at the skin as the window to our overall health. And so sun care just kind of becomes part of our lifestyle. It doesn't become a big chore. And so my biggest tip here is to keep it simple, make it a habit, not a chore. Sunscreen it should be part of your morning routine, just like brushing your teeth. Like you don't wake up one morning and think, today I feel like brushing my teeth, or today not so much. It's gloomy, I'm not going to do it. And so it needs to be part of your daily habit, just like that. And finding the sunscreen that works for your need is probably the hardest step. But once you do that, it gets much easier. And then, as we talked about, there's other ways to protect yourself, and wide brim hat, sunglasses, especially to protect not just your eyes, but the skin around your eyes is extremely delicate and prone to wrinkles as well. And so sunglasses, super important. And then even umbrellas.
Well, I want to add one more point because I saw a couple questions come in here about reapplication of sunscreens and questions around, how often should I be reapplying my sunscreen? And so I want to take, a little bit of time to talk about that as well. So you mentioned you should definitely be applying it straight away in the morning as part of our daily routine, but then we also need to think about reapplication throughout the day. So if you're using, a normal sunscreen, we really do recommend, it's on the back of the label as well in the drug facts box, to reapplying your sunscreen every 2 hours. And if you're wearing a water-resistant sunscreen for days where you're going to be sweating a lot, maybe you're exercising outside or you're at the beach, to really apply every 40 or 80 minutes. And of course, you can always reapply more than that if you're even more hesitant, but those are the recommendations for you in reapplication of sunscreen. So
Yes,
now
reapplication is so important.
oh, it is, and it's so hard, especially when
It
you're
is.
at work or just going through your daily routine. So that's why, again, as you mentioned, finding the product that you like and the format that you like that's easy access for you in that moment is so important. So yeah, the last question that I really wanted to get your insight on, Dr. Zion, is what do you say to people who still don't think they see the importance of sun protection?
Yeah, I think there's still work to be done overall from an educational standpoint. Us even having this discussion to spread awareness about, skin health and the risk of skin cancers, and providing accessible information to all is a step in the right direction. Everyday sun protection is so important for a number of reasons. One being prevention of skin cancer. We spoke a lot about this today. Do your monthly self exam, hashtag get naked, get your annual checks with your healthcare provider, and the sunscreens and the sun protection. Another thing is, think about the number of videos that we watch on TikTok about, how to treat wrinkles, how to treat those fine lines. And, those fine lines and wrinkles can be put off for years just with the small addition of daily sunscreen, hats, and sunglasses. And so make it part of your healthy skin routine. I'm going to assume that if you're on here today watching this live, that you have seen videos, if not mine, many other videos from other creators about skincare routines, and you're probably including fancy ingredients like retinol and vitamin C. But if you're not using sunscreen and sun protection, you're basically wasting your time and money.
Very true. So now what do you say to people who we've convinced are just starting their skin, sun protection today?
Yeah, it's
We don't want those timelines. Is it too late?
exactly. It's never too late to start wearing sunscreen and protecting yourself. Like I said, try adding it to your morning routine, after your skin routine, and before your makeup. And, like we talked about today, the key is really finding that product that works for you, your skin type, and your daily lifestyle.
Well, wonderful. Thank you so much, everyone. Thank you, Dr. Zion, for joining us today. Again, to learn more about melanoma, please, go to melanoma.org, look more into, Walgreens and the Melanoma Research Foundation and Neutrogena to learn more about sun protection and the effects of sun damage on your skin. Until next time, everyone, it's been great talking with you.
Thank you. Bye, Dr. Rank.
Thank you. Bye.
Bye.